Hey, everybody. Welcome to another episode of the AnxietyRX Podcast. I am your host, Dr. Russell Kennedy. As you know, a medical doctor who struggled with significant anxiety for a long, long time and found my way out through non-traditional means. So today, I've got Dr. Nick Holton and Dr. Adam Wright with me, who are involved in the Anti-Fragility project. I don't know if I can call it a project, but I'm going to get to introduce each other and then we'll just go from there organically.
Great.
What's up, guys?
How we doing? Thanks for having us.
Good. Yeah, good.
Yeah, so I guess we'll just introduce ourselves. You'll see Adam's will be short. Neither of us love talking about ourselves, but the background here is I'm a longtime career educator that left education really, I think, in part because it was disenchanted with its, inability to, let's say, cultivate human potential. And so that led me to doctoral studies in, essentially what is, well-being science, eudaimonic well-being, meaning-based well-being. And through that, started exploring more and more different elements of well-being, performance, resilience, aspects of human potential. And so now it's for a decade plus. I've worked with CEOs, professional and collegiate athletes. We work with a lot of high pressure performers, so legal, medical, I mentioned athletes already, finance, aerospace, those sorts of things, really trying to help them find what we would consider to be sort of this integrated intersection of, performance, fulfillment, well-being, those sorts of things, right? We I think would argue those are sort of the best pathways to actualizing somebody's potential, right?
Yeah. What an easy complex that is.
Yes, right. Absolutely. Yeah.
For sure.
Yep.
And Adam, what about you?
Yeah, so it's almost like a Venn diagram where Nick is coming from that well-being, positive psych perspective. We're both focused and we share this interest in human potential and I would say human performance, both in terms of an optimization perspective and also in terms of a flourishing perspective. And then my background is more in the performance and clinical side, and my master's and PhD was in sports psychology. I started my life in exercise science, actually, as an exercise physiologist and a professional strength and conditioning coach, more and more interested into the psychological side of things, and worked about 10 years as a professor and as a consultant. But right now, my primary role is working with Nick in the Anti-Fragile Academy, and I also direct mental skills for the Washington Nationals, which is a Major League Baseball team. I deal with their 40-man roster.
Wow. Yeah, I'm sure, if you're going to be a sports psychologist, getting up into that major league thing, I imagine is a really big deal. It's kind of like the show in a way. And
I always say it's a holy grail. Be careful what you ask for. There's 30 of us in the world that get to do this and run a team, but it's a lot less sexy than it sounds. I think I always tell our grad students and the people, it's just they're people dealing with the same thing everyone else deals with. It's no different. Stress on the brain impacts us all the same way.
Sure. And Nick, the disenchantment with the educational system is like my disenchantment with the medical system, right? We're just basically putting Band-Aids on stuff most of the time. Now, I love medical doctors. I have nothing against psych meds, none of that sort of stuff. But I do think in medicine and psychiatry, we are sort of trained in this paradigm, this very pharmaceutically based paradigm with, short episodes with a patient. So you don't really get into, especially emotional disorders. Someone's got congestive heart failure. Yeah, I can give you all sorts of ACE inhibitors and all that kind of stuff, and show your studies and that kind of thing. But when it comes to the brain, when it comes to human performance, so much of it I talk about is we are mind, body, spirit. Right now, mind we're not so bad at, in medicine, psychiatry, and psychology. You could argue that. Body we're pretty good at in medicine. We know the body fairly well, but spirit we have no idea. No idea. And I think so much of human potential involves this spirit because we're so cognitively driven. We worship the mind in this society so much that we don't get into that aspect of like, okay, what actually drives you from a spiritual perspective? Because that's essentially what's going to heal you. Anybody want to jump in there?
Go ahead, Adam.
I think when it comes to the work we do, I always want to understand, like, if you don't know your purpose, right, we really have no beacon to direct us, in terms of where we want to go. So a big portion, I think, in the work that we're trying to do is align people, not just as setting goals, but to have value-based goals. And so many, I think, regardless of your profession, I think so few of us take the time to really understand, like, what we want out of this life and what we want out of this job and what we want out of these relationships. And I think it ends up being a foundational perspective from which we, approach our clients.
Yeah. We'll talk obviously a bunch about anti-fragility, but the basic idea is, can you thrive maybe through and even because of, let's say, general adversity? We can get into the specifics, right? But the important part of that is, can you thrive?
Yeah.
Right. That's the energy piece, the vitality piece, whatever it might be. And so I think, we always want to kind of try to keep that front and center.
Yeah. One of my trainings is in somatic experiencing therapy. So I have a really kind of hardcore read papers, neuroscience background, but I also have this kind of woo-woo. I'm also a yoga teacher. So I have these two sides of my brain that fight with each other all the time. What I think we want is not so much we want what we want, is we want the perceived feeling that we're going to get when we get this thing that we want. So it's not like we want $10 million. We want the feeling that we're going to get when we have that $10 million. And then we forget to see that feelings are fragile. They come and they go. And there is this kind of thing. And especially I notice this a lot in the States, is that like, when you get this money, you'll be, you gotta get up at 4:30 in the morning, half an hour before you go to sleep, and you gotta work, and it just seems so plastic to me. Maybe it's because I'm Canadian, maybe it's because I'm more laid back, but it is one of those things where I see, is this drive to something really who we are, or can we get there organically? And when I heard the term anti-fragility, it's kind of like, we talk about in somatic experiencing building resilience and capacity in the nervous system so that we can handle these negative things and actually, as cliche as it sounds, kind of turn them into a positive. Because I see this with our kids, they're not getting challenged in the way that they used to. It used to be mom, I'm doing a lot of talking here, I'm going to let you guys talk in a minute, but mom would be the nurturer, dad would be the challenger. And that's how we would grow as human beings. So we need that challenge, but we also need the nurturing. So we need the rupture, but we need the repair as well. And I think so much now we're trying to catch up by doing repair when we should be proactively looking at building, resilience.
You just hit the nail on the head with the specific word, proactive, right? We would argue sort of that is the key distinction here. And that's, to your question earlier, I think why it's so important for parents and coaches, leaders as well, is because what we're talking about, which is a bit of a paradigm shift and kind of uncomfortable for a lot of parents, is proactively, intentionally finding sort of the right little stressors to introduce yourself or someone that you care about, right? Building resilience in to, right? And if you can do that thoughtfully, and what we're basically arguing, the idea of anti-fragility, but there's a lot of different ideas out there in sort of the biological world, psychological world as well, is that if you do this thoughtfully enough, like you just said, you're going to not just sort of make them a little bit more robust, which is in and of itself a good outcome, but you're likely going to increase other capacities as well. And so far, from what we're seeing from very, very early science, mostly theoretical, a little bit empirical, to your point earlier about rigor, is there's some associations to suggest that is the case.
Yeah. I mean, if you look at two kids, one that's raised in a family where there isn't a whole lot of, difficulty or pain or whatever. And then another that's raised in some trauma, but the trauma is repaired. The trauma is repaired. Say, an uncle dies and the parents do a really good job of repairing that, or they're bullied at school and the parents do a really good job of that child who was traumatized and repaired has a much more resilient nervous system than the one that sort of went through life without a whole lot of trouble.
Post-traumatic growth.
Yeah.
And I think the important thing to note there, and we talk about this a bit in looking at the resilience literature, is that resilience is the default reaction. So what you see is in potentially traumatic events, most people will end up on the side of resilience. The question is those that don't and do, have this, post-traumatic stress impact, what's going on in their lives? What's happening in terms of adverse childhood effects that allows for this other path to be taken? And what you see clearly is kids that have, we call it the stealing effect, these early controlled exposures to stress with the right system around there, effectively acts as inoculation to stress. It creates better mental toughness, emotional regulation. And we're using this term anti-fragility and looking to operationally define it because we think like resilience, it's almost like resilience 2.0. It's taking it a step further. Rather than things happening to you, let's do it. Let's titrate it in a certain way, right? With the support system around us, high challenge, high support, so that we can grow from these experiences.
So what does anti-fragility mean to you guys?
Keep going, Adam. Oh, right as you take a sip.
I was needing a little caffeine hit.
Yeah.
Go ahead, Nick.
Good timing.
I'll chime in.
So, I referenced like kind of Nassim Nicholas Taleb's original definition from his book Anti-Fragile, which is basically thriving through or really because of adversity, right? And he referenced it specifically as kind of an approach or a mentality or paradigm shift for black swan events, these exceedingly sort of rare events that would be shocks, in his case, typically to like socioeconomic systems, right? Those sorts of things, risk analysis, right? Organizational management, those sorts of things. What we're really trying to say is when you look at concepts like hormesis, right? Supercompensation, those sorts of things, like there's plenty of good, I think, both theoretical and empirical evidence from other fields, but we're starting to see it as well in psychology and neuroscience. It says, do individual humans and or groups of humans, right, have this capacity as well, right? What would it look like to take this and extend it so that we can, potentially train a human being, coach a human being, or a human being can learn, right, through their own sort of devices, how to thoughtfully and intentionally grow from not just stressors, but potential shocks to the system in a way that I wouldn't say makes them invincible, but certainly the incentive or the interest is it makes them a little bit more impervious to some of the natural difficulties that come with life, right?
Did you want to add something onto that, Adam?
I mean, the idea with black swan events is they're unique, they're rare, they have a severe impact. It's almost like a paradigm shift. There's a lot of hindsight bias where you're saying, oh, well, it could have been predicted, But part of the issue with this is like that's what gets us into this. This is the problem to begin with. The idea of looking for this linear narrative that exists, and that's part of the anxiety. What's saying so anxiety provoking. Sure. If we could learn to just sit with the ambiguity and put systems in place that we could deal with whatever comes, like bring on the chaos, amor fati, as Nietzsche used to say, embrace our fate in such a way. But we're not doing this alone. Resilience isn't just in us. And fragility is not just in us. It's within our culture and the system that we can co-create as, therapists and teachers and coaches and parents.
And that's where we're kind of aiming for. And I think we need leaders that can kind of come up and say, hey, we do need this stress, but we also need to focus on repair as well, because so much of it is like, oh, you went through this, you got tougher, but we don't assess how much damage that initial trauma did to people. I'd be curious as to how many major league athletes had trauma in their childhood. Like if you look at Goggins for one, right? So he had a tremendous amount of trauma as a child. Like he was beaten by his dad quite severe, right? So he rose above that to become like a super achiever. And I'm wondering, just the question when you said you're working with the Major League Baseball team, I'm wondering about how many of those guys went through significant trauma and learned, okay, I've got to be bigger, stronger, faster, better than everyone else. But at some point, because I deal with some really high achievers over in Europe, and at some point their body starts paying the price. Late 20s, early 30s, that sort of I got to be the best, I got to drive. It sort of starts working against them rather than working for them. I don't know if you've had any comments on that.
Two comments. One, I think we have to be careful about trauma with big T and a kind of a little t.
Right. And
also just in terms of one's subjective experience, what may be traumatic to one individual might not be so traumatic to another. It might just be, a regular day occurrence. So we have to be careful not to project our ideas that lens on, seeing life through their world, our world to influence how we're interpreting their life. At the same time, there was a very interesting study. This was an international study looking at Olympic athletes who received gold medals, and then looking at adverse childhood events. And there was a very strong correlation. Right. And from that, there's a saying in sports psychology is that, talent needs trauma. When talent means talent is not enough. And sometimes having a chip on your shoulder based upon what happened in the past, if leveraged appropriately, can make one achieve to greater heights. However, if that's probably the only thing that's driving you, at some point, it's going to unravel.
Yes.
Right? That thread of that tapestry is going to unravel, and you better have another system in place to hold things together.
Totally. Yeah. Couldn't agree with that more, because I do think the people with trauma are the ones that change the world, because they have to go beyond it. And I think a lot of my friends, I did 10 years of stand-up comedy where I toured through Canada. And it was one of those things, like, I didn't meet a comic who didn't have trauma. You know, they just don't. If you look at all the famous ones there, except for Seinfeld. The curious thing about Seinfeld is that both his parents were orphans. So it's kind of, you know, there is that sort of inherited family trauma sort of thing that comes through people sometimes. So
maybe it's epigenetic.
Yeah, there's people that do these things that go well beyond the means, and Goggins being probably the prime example of that. Just driven, and eventually, though, it does kind of, the resilience does kind of, you run out of train in the track, you run out of track of the train. Right. So it's like what you guys are talking about is, how do we proactively build that resilience so that we can keep building the track? You know, you're not going to change that like Goggins is not going to change his fundamental mindset, but how can you make him survive longer and live longer and sort of break into that realm of happiness? Because I have a sense, and I don't mean to pick on Goggins, but it's just, I have a sense that when you're driven like that, life can't be fun as a whole. I mean, I'm sure there's great moments, but as a whole, I don't think when you drive yourself that hard that life can be enjoyable.
So this, I think, is, unless you want to jump in here, Adam.
I can make a quick comment on Goggins in particular, but if you're going to go there, go ahead.
Well, so I think we should talk about comedy, one, because I think that's a good route to talk about anti-fragility. But yeah, at some point I want to come back, and because you said enjoyable, and this is where we can nerd out on well-being science, but there are different types of happiness.
Sure.
A joyous one is one of those, but that's different than a meaningful one in some cases. So we can come back to that, but go for it, Adam.
Yeah, without going into detail, I mean, he's a remarkable, he's an outlier. He's he's one in a gazillion, right? He went through all the special forces and all, right, and all the elements that, the Army, the Navy, and Air Force, so forth, and ultra marathons with broken legs and a failed kidney. Like, it's ridiculous.
Yeah.
At the same time, right, he drove himself to do that, lost 100 pounds, got off the couch, and forced himself to go through this. But remember, like, his whole idea of staying hard, he also immersed himself in systems which facilitate that way of thinking and support him. So as much as from his perspective, it's all about him, and maybe it got him there, but this is what the Navy SEALs do. Right? They take unique individuals and they structure them to be anti-fragile. So it wasn't all on him alone, right? He needed a system around him to allow him to be David Goggins.
Oh, sure.
And I don't know if that's always communicated, because kids love to talk about Goggins. They want to emulate him. They look up to him. It's like, it wasn't all on his own.
Right.
He was in a support system as well that helped him achieve these things.
Right. And that makes sense. And I think, when you look at the mental health sphere, which is what I deal with, people look at the trauma that typically wasn't repaired. And still, like, my theory is that it's held in the cellular matrix of the body.
Yeah.
Trauma is held in the cellular matrix of the body. And we're seeing more and more experiments now that show that memories are held cellularly.
Yep.
So it is one of those things where I had this sort of argument with someone the other day. It's like, well, trauma is, how can you say trauma is held in the body? Are you doing this to make money? It's like, no, if you look at it, and then the way I did it was, is trauma held in the system? Like, there's someone who is emotionally, physically, sexually abused as a child. So they hold that in their system. It's like, yes. Okay. Where do they hold it? They hold it in the brain. Okay. It's held in the nervous tissue then, but it's not held in the body. It's like, no, not held in the body. It's like, okay, can you separate the mind from the body? Can you? It's like, and then they go, well, no. So by definition, if it's held in one and you can't separate one from the other, then trauma must be held in the body. And that made them silent for a little bit. But it's interesting, like, how we address trauma. Like, I don't really like the word trauma. And what you hit on before was perfect, Adam, because we're starting to see more and more that general sensitivity is almost genetic. Like, if you ask a mom, which of your two kids is more sensitive, immediately they will tell you the one that's more sensitive. So if you're born sensitive in an environment where you're loved and protected and there's a lot of attachment, you'll do fine. But if you're born sensitive in an environment where there's trauma and it's not repaired, then you're starting to get into the, pushing into that area where you become these coping strategies. And some people rise above the coping strategies, like Goggins, and some people fall below it. And those people commit suicide. Like, that's the extremes, of course. But it's like, how in the middle can we take that gray zone and say, okay, this is what you went through. How do we expand the capacity and resilience in your nervous system so that when you experience something like this again, because life will always give you more crap to deal with, that you will have this ability to kind of take a different path?
Can I just make one comment about the epigenetic inheritance aspect of it, because it's something interesting to me. Very famous. You may know that male rat study. I don't know if they were exposed to a specific scent. Are you familiar with it? Yeah, while simultaneously receiving an electric shock.
Blossoms? Yeah.
And they created a fear response, and the conditioned them to associate that smell with danger. And so they were fear conditioned, and guess what? It was transferred to their offspring.
Grandpups,
right?
Yeah.
There was no training involved.
Exactly.
Those offspring grew up, and they were exposed to that scent, and guess what? They had a memory, and that it was dangerous.
Yeah.
And they had a fear response to a scent that was otherwise innocuous.
Because they weren't exposed around their parents. They weren't exposed in. It was
they controlled for all. Yeah.
They weren't
like cherries or almonds. Yeah. It's like
and then
a set of phenone.
The grandpups chew that scent, and they had a huge cortisol response when they had no response. The only way they could have, that we know of, that they would have been able to access that and create a response to it would be through epigenetics or through inherited family trauma.
Some kind of markers in our DNA was,
We're starting to see that more and more of trauma is held through the male sperm rather than the female egg, which is really interesting to see, because it's
that's very interesting.
And when you look at it, there was a study recently that actually was not recently, but it was about that women who had trauma had offspring that were very sensitive in general. But if the males had trauma and the women didn't, those offspring had a much worse cortisol or much more pronounced cortisol reaction. So it's almost like the woman gets the trauma from the sperm. Again, another bad thing about men,
add it to the list.
But I guess if she had a man that she had to take care of as well as a baby, of course that child is going to have more reaction. So it's just really interesting to see how we have this sort of single-minded view of trauma, that it's just these one experiences, and it's just so many different things. It's just a milieu that we live in. So dealing with something like anti-fragility, because we're not going to change the trauma, but we are going to change the way we look at it, and we can kind of have access to repair it. And I imagine that's what you guys are doing.
Certainly trying to, yeah. Although I don't know how much, Adam, you'd speak to this better. I don't know how much reparative work certainly we're trying to do, right? Like that's where the proactive piece comes in.
So my argument is there are many ways to impact people in a positive way, and you don't have to do therapy for something to be therapeutic.
No, exactly.
So if the goal is well-being, by the way, it may, in the process, by the way, and we can look at these larger studies in terms of therapy. If you look at some of these meta-analytic reviews that are looking at what is actually accounting for real change within the therapeutic process, you could have 100 different theoretical orientations. Guess what? There are certain common factors. You know what they are? They're relational.
Exactly.
It's all, positive self-regard, a real connection, support, a safe space. That is curative. So, if that's part of what we do, is that's part of our context, why not?
Yeah, it's providing that background of safety. In traumatic experience training, they say, we deal specifically with people with trauma. That's kind of my thing, that kind of thing. It's not more of a performance kind of thing. So I think I sort of move them through their trauma and then hand them over to you guys. But it's always, it's a combination of both, for sure. Like as people start getting this sense of safety in their nervous system, they're not quite tripping over into their emotional brain so much, and they can more lean into curiosity. They can more lean into the rational part of the brain, medial prefrontal cortex, lateral prefrontal, that actually has these effects, calming effects on the amygdala. So once we learn these kind of cognitive structures, they can help. But if the bottom up part isn't there, it's very difficult. Now, again, I'm dealing with a traumatized population. You guys are more performance driven by the sounds of things, but it's really creating that safe place because in that safe place is where a lot of neurogenesis occurs.
Absolutely. And just as a side, I have a clinical practice too, intervention training. So I deal with trauma victims. And so, Vanderkolk's work, I'm very interested in, but I was trained psychoanalytically. So much of this is turning what is otherwise implicit into more explicit, memories, and putting words to this process and creating a clear narrative in a safe space where the nervous system is not overwhelmed, to help with verbal recall and to manifest some of these physical sensations, emotional reactions in a safe place is curative as well. So I think probably share some of the same, maybe a little different approach, but some of the same work.
Yeah, and just, the hippocampus is so critical for learning, right? Mm-hmm. And the hippocampus is shut off by cortisol. So it's one of those things that, unless you have that element of safety in it, you can learn, of course, but you're just going to learn so much better if that hippocampus is online and you're able to sort of take things in short bursts so that you can actually learn. And we're seeing that more and more, like human learning. And I don't probably have to tell you guys, but it's better to do short bursts. It's better to do 5 episodes of 10 minutes than it is to do 1 episode of 50. Right. And it's like, how do we get that? And it would be really interesting to look at that in sports performance, like these body memories that we create. I often say to people, well, how long is it going to take me to heal from this? It's like, well, if I told you that I was going to teach you how to unlearn how to ride a bike, how long do you think that would take you? And there's that really interesting thing on YouTube that they did about the guy who built the backwards bike. Did you guys see that one?
I used to show that as an introduction to neuroplasticity.
Right. So it's just like, how long would it take you? Like, it took the inventor 8 months to be able to learn to ride the backwards bike. It took his son, who was 14, I think at the time, 3 months. Right. So it's one of those things, like a lot of this trauma stuff is body memory in a way. And that's a sort of colloquial term for sure. So how do you start moving people away from these body memories and creating, I imagine what you guys are creating, body memories that are positive, that are forward moving, as opposed to these, negative, amygdala driven reminders of their negative past.
That is certainly depending on the context. Like so a good example of that, right, is a collegiate sports program we're working with right now. And so, contextualize it. Their specific challenge is basically the postseason because it coincides with finals. So basically you have these kids who are already time scarce, right, with very few tools, real tools for just like navigating life outside of the processes they repeated in high school, who all of a sudden just like the perfect storm, shit hits the fan, right? And they don't know how to handle it. And so you could say, all right, well, let's, train you up in some skills. And then, hey, when April comes around, good luck, hope for the best. Or you can throw them into mini fires before the big one. Right. And you can have them practice these. And when you say it like that, to me, it's kind of oh, duh. If I wanted to get better at hard stuff, I would just practice hard stuff, right?
Yeah, and it's almost like a sine wave too. So, you give them the hard stuff, you show them how to repair. You give them the hard stuff, you show them how to repair. And the amplitude of that wave is like, okay, the difficult stuff, we'll give you something very easy first, and then go back, and then they get harder and harder and harder, and then sort of the basal ganglia, the amygdala, the brain kind of learns like, oh, this is challenging, but it's not going to send me into a cortisol release. It's not going to send me into adrenaline release. It's going to be like, I need a little bit of that, but also on top of that, the adrenaline cortisol stress response, the classic stress response, comes down faster. Because typically with people with trauma, and I imagine if they're under the gun with the exams, their fight or flight response is going to go up high, and it's going to take a long time to kind of get down to the lower part of it again. And while they're in fight or flight like that, like I said, the hippocampus is not blocked, but impaired. So if they're trying to learn in a high sympathetic tone, it's not going to be going well for them. So what would you guys suggest? Like how does this work?
I was going to make a joke, Nick, and then if you want to get
go. No, I was waiting for you.
No, I was going to. So, and by the way, there's something very interesting to us in the work we do, looking at HRV as a metric that really is telling us the story of the nervous system and the rigidity and dysregulation that often happens. But I was just thinking Yogi Berra, who I love, and I use him as a quote. I was a philosophy major a long time ago. I was like, he's one of my favorite philosophers. But the idea that baseball is 90% mental and the other half is physical. There's something intuitively correct about that idea. Maybe his math was off, but there's something about this idea that if we approach human beings, if it's all nervous system, and that it's a true biopsychosocial approach, regardless of their state, wherever they are, right? I think we could I think we could speak to people in a way that could resonate and meet them where they are. And part of what we're trying to do is to bring this information in terms of best learning practices. Nick's an expert in this as an educational psychologist, but also try to meet people where they are. Give them pieces, and it doesn't have to be an overwhelming text, right? We could pick and choose what we want, create a curriculum around this, and teach them rather than waiting till they are ill and they are dysregulated and they can't take any of this in anyway. Right. So, yeah, go ahead, Nick. I'm sorry.
It is, in terms of the paradigm, I think you'd appreciate it, but a lot of what you see in terms of like health management versus sick management, I think is sort of like the lens we're taking here more psychologically, right? Now we say psychologically, but, to be honest, there's clearly a ton of connection because the framework language we talk about is top down, bottom up, outside in. Right? To just reinforce biopsychosocial. Spirituality too, we just file that under mostly the psychological, right? But yes, all of those things matter. So we try to hit those systematically as best we can through content that, kids, parents, coaches, whoever can access. But we also then are doing these one-on-ones or these workshops or these sort of high-level things with the high-level execs or high-pressure performers where it's very, very granular and specific, like a client we had earlier today where, it wasn't so abstract. It was just, well, hey, you're getting, under 6 hours of sleep at night. Like we can't be talking about anti-fragility if you ain't sleeping, right? Like let's just get back to basics. And so that's where you see, okay, do you call that performance? You call that well-being? You call that resilience? Like, no, it's going to contribute to all of it. So there's some core foundational things that are always going to be biopsychosocial, regardless of what state you're trying to move them to and from, right?
Yeah, like a background. So what would be like the ideal client or the ideal prospect that people would come into the program or your way of thinking? Like, what would you take them from, and where was your goal? Where would you move them to?
So like with any case, it's going to depend on somewhat like goals and sense of urgency, right? And so the client we mentioned earlier, this particular client, I think is probably at the cusp of burnout. I mean, like right at the cusp. Okay. And so there's one-on-one, or often Adam and I will meet with individuals together to kind of bring both lenses, and we'll start meeting weekly and we start implementing different protocols, help with accountability if they need it, feedback, those sorts of things. But like, let's get to it and let's start to kind of mitigate and then move away from the bad things, right, that we're leading, if you want to call them bad, to the burnout. And then eventually start to kind of build up some of the positive, if you will, things as well, right? But that might look very different with, say, that collegiate team I mentioned. We work with a bunch of different programs where sometimes it's a targeted goal, like that particular period in the season. Other times it's just, listen, my athletes are a bit too comfortable. They need some mental performance skills. They need to learn a little bit more grittiness and resilience, right? And it's a general educational experience with some additional coaching where we're pre and posting, right? We're getting different data. We're trying to see some correlations and seeing if it works, but there's not necessarily the same targeted outcome that you might have in a one-on-one or with a group that reaches out and says, I need to address this particular issue, right? So it runs the gamut a bit.
Right. So have you guys got a case study that you could sort of say, like, we took this person, this is what they came in with, like your burnout guy, what we worked with them, and just to give my audience kind of like, okay, this is the thing, and this is how they came out.
Yeah. So we can do one of each, right? So if we start on the collegiate side, and these white papers and results are accessible on our website as well. But now all this is correlational, right? We're not doing control groups here. There's all sorts of ethical things about that sort of testing process. But just terms of correlations, what we've seen now over, I think, a 3-year period with a top Division I women's soccer program. They're actually league champions 2 years running. They actually in the NCAA tournament this weekend. Is
only then we say causation.
Yes, only that's correct. Yes, yes, because of us. Yeah, yeah.
No, just kidding. Good.
But in all seriousness, we saw metrics that, especially for the first year experiencers of our curriculum, because we come back, right? And so we don't make the players who have already done it do it again. They get review sessions, they get time with me. But the players who are going through it the first time, especially, we see as much as I think 33% improvements in like goal setting and mental preparation. We see freedom from worry improve by about 20%. We see flow states increase. We see perceived resilience increase, state anxiety, trait anxiety.
Decreased by about 20%. Life satisfaction increases. And you got to look at context in which life satisfaction is increasing, let alone staying the same given the how the pressures are, so mental preparation improves by 4%. Pretty significant, I would call clinically significant impact.
Yeah. Now with the individual, it's a little different. We often don't necessarily take those metrics, right? For the individual, sometimes we will, but it's usually a little bit more, let's say, qualitative in some cases. And so I'm thinking of a particular, so this woman works in aerospace, right? Burned out, basically, right? Probably 3 years ago, I would say at this point, maybe 4 years ago. She eventually ended up working with us in part to, I think, start to build herself back up, right? She had, to your point earlier, she had recovered, right? She had cycled. I think she was back from -5 to 0, if you will. And so once we had gone from -5 to 0, the question became, okay, how do I get myself up, not just to a +5, but maybe even a +7? So when I do take on hard things in the future, I only drop to a 5.
Right.
I've got some of that robustness. I've got the skills. And so we did top-down skills like cognitive behavioral techniques, acceptance commitment techniques, mindfulness techniques. We did bottom-up things. So she worked very diligently with Adam on dialing in, energy in, energy out, nutrition, movement, exercise, sleep hygiene. And then we talked a lot outside in, relationships, networks. She's a wonderful single mother of an amazing child, right? Like that was really important to her, those relationships. So,
Purpose.
Purpose, right? Her impact through aerospace and defense. She's an Air Force vet, right? So this was like really meaningful to her. So all these things we're talking about ended up in her case, right? And we were able to do this in a really integrated way over a course of time. I actually just caught up with her last week a little bit, and I didn't even tell Adam that. And things are going great. She's feeling good. She feels that robustness. She's got a confidence like she can really take these things on. And I think that's a good example of kind of the proactive nature of some of this.
Can I add one point to this? And I think what's interesting about this idea coming out of academia and coming out of my clinical work and even academic sports psychology is how do we define mental health? Right? That's a big question, right? And I'd be curious to see what your definition is.
Well, I think that there's so many different aspects to it, right? So there's the absence of like clinical disease, the absence of schizophrenia, that kind of stuff. And then there's the what I call what you do to yourself, like consciously or unconsciously. Like worry is one of the big things. Like if you look at worry and how pervasive it is, and the reason why your brain does it is that you get a little dopamine hit when you worry. So basically, when you worry about something, you make the uncertain appear more certain, even though the outcome is uncomfortable and bad. So if you have this sort of pain in your stomach and you think, oh, I wonder if it's stomach cancer like my uncle had, right? So in your brain, it goes, oh, you're on the right track. Here's some dopamine. So you're getting rewarded for worry. On top of that, if the worry is really painful, the periaqueductal gray in your brainstem will start firing off endorphins and enkephalins. So you get rewarded for about 0.4 of a second for worry. And then you believe the worry, and then you get sucked right back into the hole again. And then you've got to worry more to try and achieve the same sense of relief that you got. So that's the first. The first thing, like clinical disease. The second one is what you do to yourself. And the third one, I think, has a lot to do with culture. Has a lot to do with the environment of go, 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 succeed, succeed, succeed. You can't fail. You can't be different. So there's so many different aspects that kind of play in there. And people generally have more resilience and capacity, or they don't. And if you had a trauma history, generally you have less capacity and resilience. If you don't, you'll still worry. Worry is part of life. Like worry, anxiety is a part of life. We all have it. But if it becomes this place that I was talking earlier, as the sympathetic tone goes up and then it goes down really, really slowly, it's really hard to have quality of life when you're being chased by a lion all the time or you're perceived unconsciously. So it's really hard for me to sort of define mental health or wellness in any particular sort of functional way.
And as a doctor, right? As a doctor, who knows better than you, right? So it's a multifaceted term. It means different things to different people. The one thing for sure I hear out of that is what? It's not simply the absence of a diagnostic criteria of mental disease, right? There's other things that one would say are important. And I think the question is, once you no longer fit a diagnostic criteria, you're back to zero. Then what? Then what? And what we're trying to do is fill that gap.
I can see that. Yeah, I think there is that sort of sense that, you finish with your psychiatrist. It's like, okay, well, we've showed you the coping strategy. It's like, okay, now what? Now, if I get divorced in 2 years, am I going to go right back to the same hole that I was in before this whole thing? So it's like, how do we build that capacity and resilience in the nervous system? And my biggest, problem with that is people, once they feel better, they don't typically want to go the extra mile, because if you're in a sports team or whatever, yes, there's that structure that you said about Goggins. There's that structure that we're in. But a lot of people, and this was my same issue with antidepressants, I would give people antidepressants thousands of times over my career, and it would help them. It would help them lower their anxiety and their depression. But often they would say, I'm not anxious or depressed anymore, but I don't feel much about anything.
Well, it's the affect period, right?
Yeah. So it's like, okay, how do we sort of build this joie de vivre? How do we build this sort of, okay, I'm past I'm now, from 0 to 5, I'm 0 to 10, I'm now at a 5, I'm level and that sort of stuff. But how do I live a life that I really enjoy?
Right. And there's a large body of literature that suggests this, that's evidence-based. And we're trying to connect the dots across these silos and communicate it to people effectively so it's digestible.
Which is amazing.
Go ahead, Nick.
Well, so that word joy came up again. And so it's a good opportunity to come back to this, right? Because if you look at a lot of the literature, now I'm gonna just kind of throw a bunch of terms in there: flourishing, well-being, happiness, psychological well-being, all the stuff, right? Generally, when people think about that as like happiness or life satisfaction, they're thinking, okay, do I generally feel good? Do I have a lot of pleasantness, right? And they might think of that as joy. They might think of that as humor. They might think of that as excitement and novelty. And what we're saying, and everything out of positive psychology and well-being studies would say, yes. Broaden and build theory of positive emotions, yes. Well-being boost, happiness advantage, yes, right? The issue with some of those fields, or at least early versions of them, is that it quickly, I think, became a little bit dogmatic around exclusively positive or pleasant experience. And the interesting irony is, and this again comes back to why we want to do this, is that if you look at a lot of the research out there, and there's great books about this, Anna Lemke, Dopamine Nation, Todd Kashdan, Robert Biswas Diener, The Upside of Your Dark Side, Paul Bloom, The Sweet Spot, right? That actually pleasure-based form of happiness, which we know is hedonism, not highly predictive of life satisfaction. But a meaning-based form of happiness or well-being, like eudaimonia, right, which I mentioned my dissertation is on, typically is. And what is often the distinction? Some sort of sacrifice or challenge or unpleasantness along the way. Translation: one of the best ways to a fulfilling life is by doing hard stuff. You have to be good at identifying, naming, and processing and navigating different emotions across the emotional spectrum. Right. And that's to your comment about mental health. I think that's a big part of it as well. We're not just talking about the absence of disease, but we're also not just talking about constant comfort in the inability to navigate hard stuff.
Because there's no contrast there. I mean, I think what human beings ignore is you have to have contrast. I mean, it's so cliche, but you have to have the dark. Without the dark, there's no light, all this stuff. But it's just really understanding that the contrast is what gives you life. This is why, our young men now who sit and play video games all day, there's no contrast in their life. When there's no contrast in your life, there's no purpose. And that it doesn't drive you out of the house to do anything. So you're trapped in that sort of same sort of what we would call a dorsal vagal, polyvagal theory, this dorsal vagal shutdown where you can't start charging up your parasympathetic or your sympathetic nervous system anymore. So there's nothing there to kind of feed it. You can, get yourself excited about something, but unless it has particular meaning to you, you're not going to follow it. And I think it's understanding like what motivates you, like what motivates us, and coming through tragedy, coming through pain, that provides the sort of ipseity, the isness of life. And I think people just don't understand that with this whole positive psychology thing. And one of the things that I train my, clients, patients, whatever you want to call them, to do is to find this alarm in their body that's firing up their anxiety. And, put your hand over it, breathe into it, stay with it, because immediately there's going to be that dopaminergic drive to go into worry. So when you feel that discomfort, what I call a cognitive bypass, you go into your brain to try and explain the feeling you have. But as soon as you do that, you lose it. And on some level, losing that feeling in your body is helpful for people that have had trauma that's stuck in there for years. But
it's actually functional.
Yeah. And until you stay and be able to actually hold that trauma and feel it, I call it sensation without explanation. So you stay with it. And then you watch your brain's compulsive need to say, over here, over here, over here, more thinking. And after a while, when you sit with that pain, and I'm not talking about people that have emotional, physical, sexual abuse in their past, like that is typically stuff that needs help. But just in general, chronic anxiety, learning how to stay with that sensation, same with Bessel van der Kolk, we're not teaching people how to get rid of their anxiety. We're teaching them how to cope with that sensation. And if you can cope with that sensation, you no longer need to compulsively go up into your head with worry, because basically that just starts this circular cascade that never ends. Because I'm going to say one more thing, is that I believe that anxiety isn't one thing but two. It's this old trauma that's held in the body that I call background alarm. And then it's your mind, which is a compulsive meaning-making machine through interoception, is always reading the body. If it reads this trauma, it's not going to make stories about puppies, cookies, and picnics. It's going to make stories about, the worst things that could happen to you. And this is my last quote, is David Goggins has this wonderful quote that says, the mind has a tactical advantage over you. It knows your worst fears. So it uses your worst fears to keep you in your head and keep you out of that old trauma that's stuck in your body from when your mother was an alcoholic and abused you when you were 5 till you're 12 years old. Now, I know I'm going on a rant here, but it's one of those things where if we can learn how to tolerate and even enjoy that negative feeling, we gain some power over it, and we don't immediately bypass into worry, which is a never-ending cycle.
You know what's good about that? A lot in terms of looking at polyvagal theory, but number one, looking at dissociation and numbness rather than looking at it pathologically, you're looking at it as a useful defense that at one time, right? But without judging it. But now let's work on better interoception. Let's not run from it. And I'm going to create a space that lets you experience all of it, the good, the bad, and the ugly. And we're going to start from there. And I think we're all trying to do the same thing. It's like, let's get away from that avoidance perspective and whatever that is, that dopamine drive that you're trying to chase, and just learn to feel more and put words to those feelings and be able to share them in a way so that now we create a new narrative, right? That get away from that freeze response and stop with the decreased heart rate and the blood pressure and the high HRV. And we're all doing the same. We're all trying to, all paths got to lead their own. I think, there's a lot of room for us all to play in the same sandbox here, but I think we need to have different ways to do it are going to appeal to different people.
And I think that's great. And I think that provides this sort of gestalt, this perspective.
Yes.
Because my perspective isn't, it's like the old Indian sage, right? The elephant, like the 5 Indian sages, and they one has the trunk. It says, oh, elephants are like spongy. And it's like, no, elephants are huge because he has the leg. But another thing that I will do with people is when they go into their trauma, I get them into their alarm, which they'll find typically in their body, usually in their midline, their chin and their pubic bone. And it's like, okay, now what was the best time in your life? It's like, well, when I first met my wife, we went on this camping trip together and everything went well. And we were by this lake. And I was like, okay, can you bring that mental image, that feeling, that unconscious feeling? But so much of what we're doing is we're trying to fix an unconscious patterned behavior
yes,
with a conscious solution, which doesn't work. Like they speak two different languages. So when you go into them and you say, what was the best time in your life? It's like, oh, I had this feeling, it was great. Like, okay, where does that feel? It's like, it's up in my heart. It feels warm and comfortable. And okay, let's pendulate back and forth. Let's go between this pain of alarm that you have, this trauma you have in your body. And then let's just dip our toe in that good feeling. Okay. And then we go back and forth. So in a way, through, I believe, the insular cortex and other parts of our brain, we create this somatosensory reference, and it's no longer this trauma is no longer overwhelming us, because when we were a child, it was. So we show ourselves, hey, this isn't all of me. So when I don't have to feel this, I know I'm going sort of more of a trauma realm than you guys are, but when we don't have to feel this way, then we have an option of choosing something different and choosing something like anti-fragility and moving into a place rather than just getting to a baseline of, okay, I feel okay now. It's like, how can we optimize that performance?
Once we could get you grounded, once we could find calmness and connection, once we could have some self-compassion and a perspective of curiosity and openness to this experience, now we take it to the next level.
Exactly.
Right?
And how do you guys do that? Like how, like, I know it's a kind of a loaded question, but sort of how do you get people from a place of, burnout or, disenfranchised with life into something, I know you mentioned earlier on, but like, how do you get them from this place to that place so that it's kind of, I imagine you're trying to get them to motivate themselves. Like when you let them go, like, there you go, little sheep. When you let them go, it's like now they're doing what you guys would do for themselves.
Yeah, Russ, I'm sorry. We're at the hour. I've got a client in 1 minute. Adam, I don't know if you're okay or what, but
I don't mind wrapping it up. How do people find you? How do people find you guys? What's your website?
So you can catch us on really mostly our website, which is just the antifragileacademy.com. Anti-fragile is one word, no hyphen, but you can connect with us on LinkedIn. We try to share some of the latest research there, as well as some practical advice. Happy to network with you all there as well, and just kind of share research, those sorts of things. Obviously, good professional setting. Kids, parents, whatever, can follow us on Instagram. We're trying to really give away a lot of the content there as well, but the website will have everything you need.
Dr. Nick Holton, Dr. Adam Wright, thanks so much for joining me.
Thanks for having us.
It's good.